You all may have seen television talking about what happens in the operating room and the surgeons' lives. Well, a lot of it is fictionalized and sensationalized. I'm here to tell you what really happens in the operating room. Hello, my name is John Lin. I'm a urologist here in Gilbert, Arizona, and I'm in the OR with Alden, one of the surgical technologists. He has been working with me for several years, and I want to hear about his perspective regarding what happens in the operating room, things that the surgeon can do to improve, and what he sees relative to what you all may perceive as what happens in the operating room. So he is a huge part of what makes me happy, what makes me successful, what makes everything flow so smoothly, what makes the OR go perfectly when I perform a surgery in the operating room. So thank you, Alden, for doing this.
Oh, no problem. Thanks so much for having me.
So first of all, let everyone know, what does it take to become a surgical technologist?
I think it's the attention to detail and also being diligent throughout the process. Obviously, the first job is to care for the patient and also put the surgeon in a good position to complete his or her task.
What you said just now is truly the key, is to put me in the best position for success. And that success is for the patient and for me. Yep. The things that you do that most people don't even see, don't even know, are the little things. For instance, we just did a TURP, a roto-rooter of the prostate. Yep. I literally came in and sat down and did the procedure. There's no me asking for this and asking for that. You had every freaking little thing set up for me.
Yes, no, that's half of it right there, is getting things ready. You have enough to worry about as far as the patient goes. My job is to just have it so you can come in, get gloved up, and get going.
And not only that, the good techs like you anticipate what I need. So throughout the surgery, you will see that something is happening, and then you will have things on the back table ready to go.
Correct. Yep. If I'm not waiting for you to tell me that you need something, if I can forecast that we're going to need something, if I can see that we have bleeding going on, if I can see any issues coming up, again, it's good to be proactive and try to do something about it right then and there.
And so much of it is the experience of you having worked with me for so long, and not only that, you having worked with other surgeons in the facility or in the past, so that you bring in all that experience and knowledge in helping the patient go through the procedure the smoothest way as possible.
Definitely. It always benefits. Like I said, I'm going on year 6. I've worked with a lot of surgeons, a lot of urologists, exclusively you right now. But and it benefits each year after year. Things get easier. Again, first and foremost, helping the patient and trying to put you in a good position to get the task done.
And it's just like you're almost like a mind reader. From my perspective, you're almost a mind reader, because I don't even have to ask for what I need. You already have it ready to go. And that's part of what makes it so nice to operate at a facility where the tech and the entire OR staff is completely in tune with how everything should go.
Definitely. Chapter 1 of a surge tech is going to be your instruments. Chapter 2 is anticipation, and that's something that definitely can't get underestimated or underappreciated, in the OR.
What will you tell other techs who may be just starting out, who don't quite have that yet? How do they get that skill to anticipate and to think that way? Because I know not all the OR techs, surgical techs, think that way.
The advice I give to other techs that are starting on is to latch on to veteran techs. The same textbook and material that you get at the end of your courses, they should be at your bedside. They should be things that you're looking through on a nightly basis. Again, I've been doing this 6 years. I know other techs that have been doing it even longer, and they reference this information daily.
In these books, do they give you like a particular procedure, and then they give you the potential instruments that are needed? How's that book laid out?
Sure, it will give you, the layout of what instrumentation you're going to need, the details of that surgery, and what instrumentation may be needed for that. It also will give you a what-if scenario and how to approach that case by case.
After working in the OR for so long, you've seen quite a few surgeons. Yeah. What are some of the habits of good surgeons that you would encourage other surgeons to continue?
pace. There will be times that you come across an issue, whether it's bleeding or something that was not, part of the plan. And part of a surgeon's job is to identify those problems and fix it. And if they could, easier said than done, take a step back, reboost and kind of approach that problem, one by one. I would just say pace. Anytime you rush not only surgery, but anything, you're setting yourself up for failure.
It sounds like you're saying kind of keeping cool in the operating room.
Exactly. Whether somebody is perfectly fine or somebody is bleeding out, you really have to stay level-headed and be ready.
So what if the surgeon is a little, is not level-headed? What did you see happen? What have you seen happen?
What have I seen happen when they're not level-headed?
Yeah.
Oh, they are just frustrated. They're not frustrated at me. They're really frustrated at the situation. Again, they will try to rush something or perhaps even take a shortcut. It doesn't always lead to the greatest outcomes, but I mean that's just worst-case scenario. I'd like to think that doesn't happen often, but I know it does happen out there. I don't see it often. I feel like I work with great surgeons, but that can happen.
So staying level-headed is what you would recommend the surgeons to do, is instead of just trying to panic and instead of panicking. Yes. and try to rush through things.
Correct. Okay. I would say if everyone could stay level-headed, that would be ideal.
What are some of the what are some of the bad things or bad habits that you have seen surgeons do?
Specifically, I've seen just poor technique as far as an approach, let's say an open belly case or something like that, where bleeding is just not accounted for. That just might be personal preference, but to me that's just poor technique. But other things would be, again, I'm just getting picky as far as maybe applying a certain kind of dressing or finishing the case out, and closing them up. But other than that, I don't see it often. Yeah,
so surgical hemostasis, it's just, it's really basic. So yeah. The thing is, what I've seen other senior surgeons is that they have a lot greater tolerance to a little bit of bleeding. Whereas for me and you and I, yeah. we don't like to see any bleeding. We want to stop the bleeding right away and then move on. So that's my philosophy, that's my technique. I feel more comfortable doing that, but other surgeons maybe feel more comfortable just kind of slashing and going.
Sure. They want to get in and out as fast as they can, and that's not always the best approach.
What else have you seen that you wish that other surgeons would improve upon, or things that you don't think that is good, besides dressing?
Sure. I've seen, like I said, I think if they can just take a minute, step back. I've worked with some surgeons who have really put themselves in a poor position, stepped away from the OR table for even just 10, 20 seconds, process what's going on, reboost, get back to the OR table and get at it. Just taking a minute away and kind of absorbing what's going on and what you can do to help the situation can really clear your head and give you a clean approach.
That's interesting. Just having a different mindset, just stepping away for a few seconds and then stepping right back at the bedside and doing the procedure.
I was going to say I used to think it was kind of overkill, but looking back, I think that's a great idea to do sometimes.
I think that is applicable not just in the operating room, in life as well.
Yep, agreed. I would agree.
What you said about the surgical dressing is so important, because in my mind, when I do like a little, when I make a tiny little incision, it's still an incision, but the size of the dressing, how the dressing looks, makes a huge difference to the patient, because that's the only thing that they see.
It is. That's the first thing they're going to take off. If a surgeon is sloppy, it shows. But if a surgeon is tactful and takes their time, then they're going to have a good wound, a good clean wound.
Yeah, perception is reality, right?
Exactly.
So, anything else you want to share with the audience regarding being a surgical technologist?
No, I really enjoy it. It's very hands-on. Like I said, I've been doing it 6 years. I've been working alongside Dr. Lin here for the last 2-3 years, and he's a great doc and a great urologist.
So thank you so much for the compliment. Never mind the Packers hat. We'll excuse him for that.
Go Pack.
Thank you also so much for watching. If you have any questions, please leave them in the comments below. Take care.